Good evening, students. This is the section for the quiz competition. So, DD best player for this class. Okay, useful for clinical orthopedics, MCQ based questions. You will try to answer the correct answers. Okay.
Which fracture is most common in children? Option A, Colles fracture. Option B, supracondylar fracture. Option C, clavicle fracture. Option D, Mondelgia fracture.
Clavicle fracture.
Correct. Second question. The most common site for osteomyelitis in children is option A, epiphysis, option B, metaphysis, option C, diaphysis, option D, articular cartilage. Third question. Trendelenburg gait is due to weakness of option A, gluteus maximus, option B, gluteus medius, option C, iliopsoas, option D, quadratus lumborum. Correct. Option B, gluteus medius. Fourth question. Colles fracture is option A, fracture of radial shaft, option B, fracture of distal radius with dorsal displacement, option C, fracture of ulnar styloid, option D, fracture of scaphoid.
Fracture of distal radius.
Yes. Option B. Fifth question. In a supracondylar fracture, the most common nerve injured is option A, ulnar nerve, option B, medial nerve, option C, radial nerve, option D, musculocutaneous nerve. Option B, median nerve. Sixth question. Genu valgum is also called A, knock knee, B, bow knee, C, flat foot, D, club foot. Option A, knock knee. The common cause of avascular necrosis of femoral head is option A, diabetes, option B, steroid therapy, option C, hyperthyroidism, option D, gout. Steroid therapy. Eighth question. The most common bone to fracture in the body is option A, tibia, option B, femur, option C, clavicle, option D, radius. Clavicle. Ninth question. The gold standard investigation for ACL tear is option A, X-ray, option B, CT scan, option C, MRI, option D, ultrasound. Option C, MRI. Question number 10. In shoulder dislocation, the most commonly injured nerve is option A, ulnar, option B, axillary, option C, radial, option D, musculocutaneous. Yes, correct. Option B, axillary. 11th question. Tennis elbow affects which muscle origin? Option A, common flexor origin. Option B, flexor extensor origin. Option C, biceps tendon. Option D, triceps tendon. Correct. Common extensor origin. Question number 12. Potts fracture involves option A, tibia, option B, talus, option C, malleoli of ankle, option D, calcaneum. Potts fracture involves tibia, talus, malleoli of ankle, and calcaneum. Correct. Malleolus of ankle. Question number 13. Scoliosis is defined as curvature of the spine in option A, sagittal plane, option B, coronal plane, option C, axial plane, option D, vertical plane. Scoliosis is defined as the curvature of option B, coronal plane. 14th question. A positive Thomas test indicates option A, hamstring tightness, option B, hip flexion contraction, option C, ACL tear, Option D, IT band tightness. Option B, hip flexion contraction. 15th question. The most common complication of hip fracture is option A, infection, option B, avascular necrosis, option C, pulmonary embolism, option D, osteoarthritis. Option C, pulmonary embolism. Thank you.